Hello, this is Ben Clover for the HSJ, talking about deficits. An HSJ analysis has shown that more than a third of hospital trusts are predicting a year-end deficit. This is an increase on the 22 at the end of 2012-13 and 31 at the end of the previous financial year. We got this data from board papers or from asking the trusts, and what's interesting about it is it's not just the usual suspects. Near the top of the table are some of the trusts you might expect, whose financial problems have been known about for some time. But the more interesting names are in the lower end, among the trusts with a deficit of 7 million or less. These are the organisations you don't tend to see on lists like this. So why such a large number this year, and why the new entrants? Well, the people HSJ spoke to said it was explained by three factors. One, the new world doesn't have strategic health authorities. These bodies sat between trusts and the Department of Health and doled out bailouts near the end of a financial year to trusts who asked nicely. The SHAs have all gone now. They did do other things as well, but that's one of the things they did. Some of the trusts have already had bailouts or get some from the NHS Trust Development Authority, which is the arm's length part of the DH responsible for looking after non-FTs. I spoke to one foundation trust chief executive who complained that the non-FTs weren't getting the access to bailouts that their non-authorised cousins had got. Hospital chief executives also blamed the various penalties trusts get hit with by commissioners for helping tip some of the trusts into deficit. This is mainly the marginal rate tariff, which sees trusts getting paid 30% of the price for each emergency admission above 08-09 levels. Monitoring the NHS England have said they're introducing rules to vary these for trusts who can show there are real increases in patient flow. But it hasn't happened yet. The third is probably the most profound and hardest to prove. Trust bosses have said they were hiring more nurses generally to try and make sure they met safety standards post the Francis report. How much that explains a sector that last year ended with a 313 million surplus, turning into a 373 million deficit this year, remains to be seen.